Edutainment Studios welcomes you to Autism Spectrum Disorder, Beginning to Understand. This module is part 5 of a 9-part series. Autism is not a single disorder, but a spectrum of closely related disorders that have a shared core of symptoms. Every individual on the autism spectrum has some degree of difficulty with social interaction, empathy, communication, and flexible behavior. However, the level of disability and the combination of symptoms varies tremendously from person to person. In this course, the objective is to help you learn how ASD is diagnosed. There is no way to prevent autism spectrum disorder, but there are treatment options you can consider. Early diagnosis and intervention can improve behavior, skills, and language development. However, any intervention at any age is still helpful. Children do not usually outgrow ASD symptoms, but they can learn to function well with them. Doctors diagnose ASD by observing a child's behavior and development. Young children can usually be reliably diagnosed by the age of 2. Older children and adolescents can be evaluated for ASD if a parent or teacher raises concerns after noticing odd behavior when socializing, communicating, or playing. Diagnosing an adult can be challenging. In adults, some ASD symptoms can overlap with symptoms of other mental health disorders, such as schizophrenia or attention deficit hyperactivity disorder, or ADHD. However, achieving a correct diagnosis of ASD as an adult can help a person understand past difficulties, identify his or her strengths, and help them obtain the right kind of help. Diagnosis in young children is often a 2-step process. The first step involves general developmental screening during well-child checkups. Every child should receive well visits with a pediatrician every few months within their first 2 years of life, then 1 time a year once they are school age. The Centers for Disease Control and Prevention recommends specific ASD screening be done at the age of 18 and 24 months. Earlier screenings might be needed if a child is at high risk for ASD or developmental problems. Those at high risk include children who have a sister, brother, or other family member with ASD, show some ASD behaviors, and those who were born premature with a low birth weight. What the parents have experienced and observed in their child is very important in the screening process. Sometimes the doctor will ask the parents questions about the child's behaviors and combine this information with his or her own studies and observations. Children who show signs of developmental issues during this screening process will be referred to the next stage of evaluation. The second step of the evaluation must be more detailed to ensure the accuracy of the autism diagnosis. This evaluation is often performed by a team of doctors that includes a psychologist, a neurologist, a psychiatrist, a speech therapist, and other professionals who diagnose children with autism. Because it is such a complicated disorder, a complete evaluation may involve a number of different types of tests. Professionals will test the child's learning skills, social skills, communication skills, listening responses, body movements, hearing, relationships to people, and more. Lead screening is also essential for children who remain in the oral motor stage for a long period of time, during which they put things into their mouths. Children with an autistic disorder usually have elevated levels of lead in their blood. If you have recently learned that your child is autistic, it is important that you ask questions and get recommendations on what further steps should be taken. Older children whose ASD symptoms are noticed after starting school are often first recognized and evaluated by the school's special education team. The school's team may refer these children to a healthcare professional. You may notice signs in your child's social difficulties as well as issues with subtle communication. These subtle communication issues may include the lack of understanding tone of voice, facial expressions, or body language. Older children may have trouble understanding figures of speech, humor, or sarcasm, and may struggle to form friendships with their peers. Talk with your child's pediatrician about your concerns, as they can refer your child for further evaluation and treatment. ASD is prevalent in adults as well as children. If you are an adult who notices signs and symptoms of ASD, it is important to talk with your doctor and ask for a referral to be evaluated for ASD. While testing in adults is still being refined, you can still be referred to a psychologist or psychiatrist with ASD expertise. These experts will ask about your social interactions, communication challenges, sensory issues, repetitive behaviors, and restricted interests. Information about your developmental history can assist them in making an accurate diagnosis. Therefore, an ASD evaluation may also include talking with parents or other family members. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 5 of 9 on Autism Spectrum Disorder, and please join us for Part 6.